Hi, I'm Dr. Lora Shahine, and welcome to my YouTube channel. Today, we're going to talk about the real costs of IVF and how people find ways to pay for this often needed, but often not covered fertility treatment. I'm Dr. Lora Shahine. I'm a reproductive endocrinologist helping people build families for over 15 years. And today we're going to talk about a really important topic surrounding IVF. IVF is a wonderful fertility treatment. Technology is amazing, and it often can be the answer to help people build their families, but it's often not covered by insurance, and people are often having to pay for it out of pocket. So finding ways to get your questions answered and tips on how to make it happen for you is extremely important. So first of all, how much does IVF cost? Well, it can be thousands of dollars. The most common quoted number is about $12,000 to $15,000 per treatment, but it's really confusing to figure out exactly what that means. And it may not include expensive fertility medications that can be thousands of dollars. It may not include certain procedures that are needed and recommended for a couple, like ICSI, intracytoplasmic sperm injection. That's an active way of helping eggs and sperm fertilize when they're in the IVF lab. And that's often not included, and that can be thousands of dollars. Also, genetic screening of embryos is often an important way to improve success rates and decrease the chance of miscarriage, but it's often not included when you're trying to get a base cost or an estimate for the cost of IVF. Why is IVF so expensive? IVF is so expensive because it's incredibly technologically advanced. You need an amazing IVF lab. You need embryologists and andrologists with years of experience. You need so much equipment, from media to microscopes to hoods to tanks to store the embryos. You need a procedure requiring anesthesia to help get the eggs out, called an egg extraction. It's an incredibly complicated and technical fertility treatment. And quite honestly, every step of the way, whether it's the medications, the ultrasounds, the anesthesia, everything needed in the IVF lab, it really is quite expensive. Why is IVF not covered by insurance? This is an excellent question. The World Health Organization, or WHO, defines infertility as a disease of the reproductive system. And what disease can you think of that is not covered for diagnosis and treatment automatically by insurance? And I know you can probably think some, but it's so frustrating if people are not able to build the family that they want to because of an issue that IVF could treat, and yet it's not covered by insurance. So why is IVF not covered by insurance? Well, insurance gets to decide what it covers and what it doesn't cover. And most people in the United States get their healthcare through their employer. And contracts between the employer and the insurance company often talk about what they're going to cover and what they're not going to cover. And fertility evaluation and treatment is often left out. There's still so much shame and stigma surrounding infertility, assumptions that it's someone's fault or someone has done something wrong to cause their infertility, or assumptions that it's easy to just adopt and that people should find alternative ways to build their family. There's so many assumptions that are just wrong, and it's not for us to judge, and it's not for us to decide what is a disease or not a disease. Now, coverage varies from state to state and exactly what is covered or not covered. At the time of the recording of this video, the American Society of Reproductive Medicine has a website and a list of which states require coverage and a little bit about what that coverage includes. So there's some states that require testing for fertility, and some states require some coverage for treatment, but that treatment can vary widely from state to state. So use this resource and look up your own state and where you work, and that can be one step to figuring out if you have coverage or not. Now, not every company covers fertility treatment, but sometimes when we live outside of a state that has mandated coverage, sometimes the employer will still cover fertility benefits. This varies widely from company to company. In general, The tech industry happens to have typically very good fertility coverage, and there's several resources on how you can look up which companies cover insurance for fertility treatment or evaluation and which don't. And it really varies by your company and even sometimes the policies within a company. So the best resource for you is to go to your HR department and the information that you got when you were signing up for your insurance coverage, and read it and ask questions and figure out if you've got coverage or not. Don't make assumptions because you might actually have coverage and not know it. So if you've done your research and you do not live in a state that mandates coverage, you've worked with your HR department, asked questions, and you are one of the many, many people that do not have insurance coverage for fertility, you are not alone. There are several creative ways to help you find coverage. Number one, double check with your insurance coverage because sometimes there's certain tests or certain parts of treatment that are actually covered. So double, triple check. Number two, fertility grants. So there are national groups, there are local groups. Do your research and you might qualify for a grant for fertility treatment. I happen to be on the board of BabyQuest, which is a national organization. They do an amazing job. We have been giving grants out for years and we're at 100 plus babies so far. It's a wonderful organization and they give out grants about twice a year and you can look online. BabyQuest is not the only fertility grant out there. There's several others. And so do your research and see what's available to you. Number three, people can get really creative with financing. I've had patients who do a GoFundMe account. I've had patients throw events where their friends will buy tickets and donate, and with the goal of helping this person or this couple build up the funds to build their family. People have gotten creative. Honestly, there's some medical loans, there's some credit card options, there is borrowing against your retirement. Be very careful and thoughtful about the options that are open to you before you decide on what's right for you and your family. But there are some very creative ways to make it happen. Some more tips as you're getting ready to plan for and pay for your IVF cycle. Number one, do your research. So be very careful what clinic you go to, what IVF lab you're choosing. Think about statistics and success rates. Be very cautious when you're looking at pricing and price comparison among clinics, because some clinics might not be very transparent in what they are presenting to you as the end and total cost. Sometimes they will advertise a very low cost, but it does not include the cost of medications or whether you do ICSI for fertilization or several other things. So just be very careful and ask really good questions. Number two, don't make assumptions. Do not assume that you have no coverage for fertility treatment. Really research your state, research your own insurance policy, ask your HR department, and ask the billing team in the clinic that you're working with. Very often they will have a history and understand or work with other people that have similar insurance policies to you, and they might be able to answer some questions too. Number three, be patient, ask questions, get advice. People can get so creative in making this happen. And if you are one of the many, many people that should and need to do IVF and it's a real financial burden, you are not alone, and reach out and ask for help. I hope this video was helpful for you, whether you are just beginning the IVF process, maybe thinking about trying to find ways to pay for it, or you're deep in it and you're really thinking about how to make it happen for you. I hope it was helpful. Please like, share, and comment on this video. Stay in touch. Follow me on Instagram, follow me on TikTok, subscribe to my newsletter. Let's learn together and stay here for more insightful videos.